Who wants to lead the pledge? Mr. Slaughter, would you lead us in the pledge?
Happy to do that. Please join me in the pledge of allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
City of Reno, call the roll, please.
Kishel.
Here.
Breckus. Zadra. Delgado. Dorch. Jardin. Sheevy.
Washoe County, call the roll, please.
Dave Humke, Chairman.
Here.
Bonnie Weber, Vice Chair. Here. Kitty Judd. Present. Marcia Burkhager. Here. Von Hartranft.
here.
City of Sparks.
Mayor Martini.
Here.
Council members Ratty. Here. Lawson.
Here.
Smith. Absent. Kerrigan.
Here.
Schmidt.
Here.
City Attorney Adams.
Here.
Thank you.
Any public comment card?
I have none, but I think you need to do roll for the Board of Health.
Oh, excuse me. Board of Health, roll call.
Chair Smith.
Present.
Vice Chair Jim. Present. Dr. Hess absent. Mr. Humphries.
Present.
Councilmember Ratty. Here. Mr. Silverman.
Here.
Councilmember Zadra. Here. We have a quorum.
Approval of the agenda. Any items you want to take out of order or anything?
Move approval.
Have motion, but second, all in favor say aye.
Aye.
Those that oppose, no. Motion carries unanimously. Staff report.
Good morning, Mr. Mayor, Mr. Chairman, council members, commissioners. For the record, Cadence Matievich, Assistant City Manager for the City of Reno. Bringing forward an item to you this morning, which is an informational item. It is not for your action today, but we felt that it was important to bring this to you because these rules, which this agenda item is in regard to, are the rules for your joint meetings. These rules were first adopted in 2004 and were last updated in 2007. Since that last update, the legislature has made a number of revisions to the open meeting law, and we feel that it is prudent that these rules be reviewed for compliance with open meeting law. Additionally, I would note that these rules are for your joint meetings, and that recently it has become our practice to hold concurrent meetings. So you may wish to do a number of things. Determine if, in fact, you wish to continue holding concurrent meetings rather than joint meetings, and if that is the case, perhaps amending these rules accordingly, or if you wish to go back to the practice of holding joint meetings. Again, it would be appropriate to determine which of those two things you want to do. Each of the governing bodies may give direction to their managers if they wish to have any of these items brought forward, and I'd be pleased to answer any questions you may have.
Is neither in that category? Oh, I'm sorry.
We didn't have that there, but certainly that could be direction that you give to the managers.
Just starting off being a smart aleck. Anybody got anything? Any changes? Guess we'll stay as we are.
Thank you, sir.
Thank you. Item number 7.
Good morning, Mr. Mayor, members of the City Councils, Washoe County Commission, and certainly the Health Board. I'm here today on behalf of a team that's been working under your direction since February 11th of last year to implement the recommendations of the Tri-Data study. This study was commissioned by the Washoe County Commission in order to find solutions and resolutions to underlying problems in our emergency medical services system. You all have received the report from Tri-Data, and the Tri-Data report first of all said we have outstanding emergency medical services in our region. and that we are operating with some of the best efficiencies that he has seen. He did, however, find 38 opportunities for us to move our system forward. And it is over the last year that your working group, which you appointed, has been working diligently forward to solutions for each of those items. And I want to first say that you empowered the managers from Reno, Sparks, Washoe County, the Health District, and the Chief Executive Officer for REMSA to come together and have meaningful dialogue to find solutions, not necessarily to address the past, but to set up a system for the future that will allow us to communicate better, use technology better, and most importantly, focus on patient care. And we've never lost sight of the words of Jim Goebbels that this is about patient care. And yes, governments operate public safety systems. They're very complex systems. They involve radios, computers, tremendous resources, and at the bottom of that is delivering to the patient the very best services we can. And we have good services here in Washoe County, but the blueprint for the future you're going to receive today is going to allow you to communicate and implement change, always with that focus of patient care. We have chosen in Washoe County to use an integrated system of having our firefighters be our first responders, to have our dispatch centers provide primary dispatch services, to have REMSA provide dispatch services for their ambulances, and to use REMSA for the transport of patients by ground ambulance and by rotary ambulance exclusively here in Washoe County. That solution can be improved by your consideration of two documents that you have before you today. In your staff report, you'll find a matrix, and that matrix provides you the blueprint for the future. We have attempted to find consensus on all items. And everyone at the table, including our fire agencies, our Washoe County Sheriff, REMSA, the managers, found consensus. Consensus is that word where we agree this is a direction we can go forward. We may not be 100% happy about it, but it provided us consensus on implementing good recommendations in a sound manner that protects you for the future. We need to write two documents now. One is a new franchise agreement, and to write a new franchise agreement, we brought you the principles. As elected bodies who make policy statements, you need to look at these principles very carefully, because from today, if you approve them, you will be empowering Mr. Liparelli's office to work with the other parties to take those to an actual agreement to drive our franchise forward with REMSA and give them a defined term for the future to be our exclusive provider. In that principles, in your matrix, you'll see how we have arrayed the changes to set up the effective communications you will need to handle changes in technology, and it's going to change in this field in the period of this contract. Importantly, we have a term on this contract. We have a term which we can use to ensure that the services remain at the very high level that they're at today. And it's that level that we want to maintain into the future. It's the new partnership that's built into that agreement for all data to come together. It's the partnership of dispatch centers breaking down any barriers of the past and working together seamlessly into the future. The principles of agreement will drive a new franchise agreement. Mr. Liparelli's office and the health department's attorney, REMSA's attorney, will be driving that document forward. I believe that can be back on your next agenda in May for your ratification as a formal change. And that change can take effect July 1 of next year, providing you a clear path on a contract that has served you well. The second document pertains to local government, and it's an interlocal agreement that will amend the original interlocal agreement that established our fine health department at Washoe County. And it does so in ways that empowers local government in their role as public safety providers to have the systems that we use be properly looked at, reported back, and performance and actions taken by you, the elected bodies, through your managers and through your fire chiefs. I want to say I'm very proud of the fire chiefs for their diligent work on this project. They came forward with lots of ideas and lots of challenges, and walked us through solutions. Mike Hernandez tackled the priority 1 and priority 2 question. And we have a solution for that, which is to put forth an annual reporting mechanism of what are the results of both fire services and REMSA services. What do these maps look like? Where can we make improvements? We have a way to bring capital forward to you, an annual report on what are our capital needs. How do we address radios, computers, dispatching, MDTs, GPS, all of those tools that will make this system work better. That's in this change document. Those are really the highlights. The interlocal agreement does empower you, and it does so in specific ways so that you can set your service levels, you can challenge your performance, and performance was very important to Manager Klinger. He spoke all the way through this process about wanting to see performance from everyone, and that's delivered by this document. We will know the entire patient story. We are asking the health department to be good stewards of a regional health care system. And they're going to do that inside of our health department by creating a good oversight process that will integrate REMSA, dispatch, fire, reporting to the oversight committee. We'll have a manager of this system. It'll be that person's job to manage this system and manage these recommendations. And those recommendations are a two-way street. Our fire chiefs, who do so much of this work through their employees and equipment every day to be the first responders, have a direct path to work together to find solutions that may blur some of the boundaries and some of the timing questions to ensure that we're providing the best service we can within the resources we have. And resources must be used efficiently today as never before. And that's a key component that we're asking our health department to do, to build the data systems that look at all of the run information, from the first time dispatch gets a call to the patient gets treated in an emergency room, and what were the outcomes. We will all maintain our medical directors, because a fire chief in Sparks or Reno or Truckee Meadows needs to have control of the medical director. That person's writing prescriptions. Those employees are working in the field under the direction of that doctor's license. We also need a doctor at the health department who can work with that group of doctors to allow us to seamlessly integrate systems and procedures to avoid some of the things that have happened in the past. We'll have regional protocols, regional standards, regional performance measures, doctors looking at doctor information, fire chiefs looking at performance information and what they can do with the many challenges they face. To aid the health department, we've also built in a medical advisory committee. This is an important group because it brings your managers to the table from Reno, Sparks, Washoe County. And they provide an overall look at what's going on in a government. And they're certainly responsible for performance within any agency. So we think they bring a good advisory voice to our health board for them to manage the system in a comprehensive manner. But on that board, we have included medical professionals that we want to hear from. Not diluted, but directly from. So you'll have an emergency room physician. You'll have someone who's in charge of patient quality care on this committee. Who better to hear from in a comprehensive manner, to provide a second voice, to provide avenues of alternatives and change to the health board. The interlocal agreement does the next step, though. It crosses from a district health department back to your boards and commissions if you're in Sparks, Reno, or the county commission, or if you're sitting as the fire board, and allows you to look at performance, to raise those challenges, to make the important budgetary decisions of where you need to make a capital investment. And that will be the key, is a blueprint for the future. Your action today on this interlocal agreement will drive forward, again, a fundamental change in your relationship with your health board to empower you as elected officials to be part of the process. And I think we've achieved these. These 38 recommendations are achievable. We have two that I want to point out that we need to work on in this next coming period of weeks. And one is how to best protect our community in a case of a failure financially or otherwise, by REMSA's operating arm, RASI. And we didn't have the expertise at the table to tackle that issue, but we will bring that to bear. The expertise we're looking at is what fundamentally happens in a case of business failure. How will a bankruptcy court or attorneys representing various parties deal with these issues? Those are complex issues that we felt we should hand to Mr. Liparelli and our fine city attorneys and our district health attorneys, and certainly the attorney from REMSA, to put forth a proper perspective on how, in a terminal event, when this thing grinds to a halt, which, keep in mind, has never happened. But we wanted to protect our assets in a terminal view so that the ambulances that went out the day before a terminal event would be on the street the next day. The second issue is what value do we need to have to run that business the next day? And Reno's finance director, Robert Chisel, he dove right into this issue. And he's got a plan, and we're negotiating that with REMSA. It involves cash. And we're trying to set a guaranteed amount of cash that we will get access to. And that amount of cash will be there for us to draw from to return those services to our citizens. Only in catastrophic failure, which has never happened, but we want that there. The amount is an interesting number. We will have access to what's been billed. Those will be receivables coming in. So we're trying to write a balancing act there between this aspect of what happens in a bankruptcy, terminal event, failure of service, and what cash we need to draw upon to ensure service is there. Critical issue, but one which can be solved by looking into the nuances of both the finances and the legal issues surrounding this issue. That will be delivered to you in your next round. And it's really the only outstanding issues, those two, that we felt we needed to get some outside counsel on and really sit down. I believe your district attorney will be able to drive 2 documents back to you by May. You will have an interlocal agreement that sets us on a course for improvement. You will have a franchise agreement back before you in May. That's a pretty good record for an issue that's been in our community for a long time. And your leadership on this issue, it was very powerful to have all of you say, in unanimous motions, go get this done. And I guarantee you, Mr. Slaughter and Katie Simon and Andrew Klinger and Robert Chisel, all 3 fire chiefs need to be thanked tremendously for the time they put in. They made this a priority. And I would be remiss if I did not thank Jim Goebbels. He brought a much needed perspective, and his leadership is one of the principal reasons we're here today. He fought through the Tri-Data report and found consensus with us on all of the points that are in here. Sure, the future will be brighter with your approvals today, but the past was pretty darn good. So take this with a lot of pride. Take this with a heartfelt feeling that you're moving our community forward, and that the next time you dial 911, you'll have the best fire resources and the best REMSA resources coming to your aid. And that's what this is about, caring for you as a patient. I'd be happy to answer any questions you may have. Motions are provided, and we can certainly take it any way you want, Mr. Mayor.
Thank you very much. Thank you, John, and the staffs and everybody for working together, working with REMSA and everything, all of you to be commended for the job y'all have done working on this. Any questions right now of any members? Yes, sir.
Yeah, Sean, did we put together an org chart so we could
We
see?
did not complete that task in the time we
Help me
had.
to understand how this whole thing, the pieces and parts fit together.
Okay. The flow
Yeah,
of decisions.
that and who's responsible for which parts and where that falls in that org chart.
Okay. We laid out responsibility in 2 places. In the principles of agreement, you will see where each recommendation from Tri-Data is spelled out how it is being met. So by using your matrix, which provides you the tri-data recommendation, unaltered, that's how it was written. We took and placed in the principles of agreement the specific change. So in the principles of agreement, all of those requirements of REMSA are specifically included by the actions we will be taking. So REMSA has very key things that they are doing to implement all of the tri-data recommendations that are assigned to them. The best way to do that is to read the document by starting at the matrix and moving to the page reference that's there. And you will see, for example, in our first one that involves REMSA, it's number 2. All dispatch centers within Washoe County should begin to collect data on arrival at patient's side. Very important new step for us to have a dynamic, comprehensive set of parameters that will guide us in information gathering of that critical piece of data. Not when the ambulance was parked out front of the hotel, but what time did the paramedics reach the side of that patient in that hotel? And that's something that's new that we'll be measuring. And we'll be doing that by turning to page 17 of the Principles of Agreement, and you'll turn to section 3B. So the flow chart, as you've requested, was embedded within these recommendations. An organizationally formed one or a decision matrix can still be developed to answer any remaining questions you have. But I don't have that here today. Going back to number 2, you will also see that it involved a change to properly implement on the side of the fire services and the dispatch centers, and by the health department in making sure that that point of data collection, when fire resources were at the patient's side and when REMSA was at the patient's side, could flow into our health department as a common string of data that could allow us to look at what actually happened. And when you look at what actually happens on an individual case basis, you begin to measure quality one at a time. And that's what's most important to the patient. Anything else I can do on that one? Okay.
Thank you, Mr. Mayor. I just have a couple of comments. I'm not sure whether this is the exact right time, but I'm gonna just express a couple of concerns that I have. And then I'd also like to hear from our sheriff, and I'd like to hear from our fire chief with respect to how, and Sean, you don't have to leave just yet, because you might be able to answer some of these concerns. So I'm not trying to put you on the spot, sir, yet, darn it. A couple of concerns that I have are the wait times that we have in the outlying areas where we call those best effort right now. And then another concern that I have is how we're going to deal with firefighters assisting REMSA, because as you well know, that puts one of our engines or your engines or the city of Reno's engines out of service for a time. And so those are issues that I think we need to address, and I recognize that we are moving forward, and I applaud this effort. But in thinking about this as a whole, I'm questioning, are we dealing with this regionally? Example, in South Washoe Valley, would it be best that REMSA tries to respond initially, or potentially let Carson City respond, especially if there's anything beyond an 8-minute time frame? So that's just one example that I would use. Wadsworth is certainly a concern for me. Mount Rose is a concern for me. Spanish Springs is obviously a big concern for me.
I think your question at its very root relies upon a new authority that you have as a county commissioner, and that's concurrent review of the outcomes of performance. And so we're going to measure all of the information. We're going to look at the performance in the outlying areas. And for the first time, you'll get that report to you. It'll come to you with a report on an annual basis that will give you the facts. That will give you the facts. And when you see something from a factual basis, you'll be able to challenge this system, because the system works in two directions. Information that you're receiving from your constituents, we can look at the data. We have a management arm inside the health department that's working with our fire chiefs to tackle these problems. There are maps that we use, and that map is going to be updated annually and put before you. So you're going to see all of the data. We're going to do this regionally in terms of its overall system performance, but your fire chief and your sheriff will have a unique ability to see the data for their regions. Not one region, but their regions. Your example of South Washoe County, where REMSA is that providing the exclusive franchise service to, is one where all the data will be captured. So you will begin to be empowered to much better respond to challenges in the future. And you may challenge REMSA to look at how they're doing this. It's important we manage this as a system. And if they aren't the best provider for the outlying area, Jim Goebbels will tell you he has mutual aid agreements with all surrounding areas. And when that call gets to the medical dispatcher at REMSA, who has the training and experience to get to what's needed on the scene and how quickly, they will be able to dispatch their resources, dispatch fire resources, and for the first time, your responders will be able to see who's doing what and when. So the detection of those problems, and your Chief Moore is concerned if he's putting an engine in South Washoe County out of service for a long period of time because of response time. But he's going to see REMSA's response. He's going to have his engine see that response, and they'll be able to make those decisions in the REMSA Dispatch Center much more quickly to know where the resources are and when they need help. So that call through an existing mutual aid agreement can be made to possibly a closer resource. It could be Carson City, it could be Story County. But those surrounding agreements are in place. And by managing that centrally, you allow us to look at the resources we're using, how we're using them, and what resources could be brought in to, again, get that better outcome. Now, the map that comes back to you, particularly for the county, is going to be very important. When you see the new systems of data, you're going to need to challenge your own services, and you're going to need to challenge REMSA services. And that's the path to the future that you'll be provided. I would be happy to have Mr. Goebbels discuss with you his arrangements on mutual aid and touch upon the communication systems that he would bring to bear. But I do know Chief Moore knows this is an issue, and he's going to relentlessly pursue it as this system rolls out. Once we have this agreement in place by July 1, it's real data, real time going forward.
Before we bring up Mr. Goebbels, I think it would be important, Mr. Mayor, if I may, can we hear from our sheriff and then our fire chief? I don't know where you are, Chief Moore. I
He's
know
over
you're
here.
somewhere. Oh, I beg your pardon.
Good morning, Mr. Chair. Sheriff Mike Haley for the record. Specifically, Commissioner Hartung, to your question, the tackling of and resolutions of the 38 Tridata challenges set in place a set of systems that will allow us to inform ourselves about what we're seeing. More specifically to my area of activity dealing with capturing of radio communications, the resolution there is that we are doing two things. One, we're putting a gateway in that will allow us, Reno, Washoe County, to hear the dispatch of medical services and to interact with that dispatch of services and to actually enter that run into the CAD and via a single identifier, so that later on, and this is the important part, I think what Manager Carey was talking about, later on, the information gleaned from that new ability to communicate and listen and share will then inform us about what our units are doing, how much time they're doing it, our resource allocation. It'll inform us about that. That will then give us the types of information we need to make a reasoned decision rather than a gut decision. One final comment is that aside from TriData's report and the work done there, the City of Reno through Grant, Washoe County, and Sparks are all working towards either an upgrade of our Tiburon system, which is the CAD, or to bringing Sparks onto that CAD. That will, by virtue of having one system in the region, also aid in informing us about resource allocations and all of the other important data. What we lack right now is good data, and this will help us do that.
Thank you, Sheriff.
Thank you, sir.
Morning, Mr. Mayor. For the record, Charlie Moore, Truckee Meadows Fire Chief. Commissioner, nothing much more to add, more eloquent than what Mr. Carey has said, that we need good data and we don't have it. We need to understand the time intervals from when the 911 call comes in, from when it was dispatched, from when the call was triaged, to when REMSA is dispatched, to when fire is dispatched, to when we arrive, and when we finally touch the patient. So when we know those time elements, then we can make a better decision as to how to fix things if we do indeed find a problem that needs to be fixed. All we have right now is to rely on anecdotes, and unfortunately, that's not good information to base good decisions on going forward. But if you recall, Dr. Cohen said one thing, that if you do one thing in this whole study, that's fix dispatch. And the way to fix dispatch is to have transparency in the data, to have communications going back and forth between REMS's dispatcher and Washoe County ECOM, and also Reno ECOM. And so that we can have a better way of talking to one another, because right now we can't.
So, Chief, then lightly touch on how will the system tell us if we have an engine out of service and for what length of time that engine was out of service because we were assisting REMSA?
Well, we will have that in our CAD notes, but ultimately, I think one of the things we have talked about is automatic vehicle locators, so that the dispatcher can see the position of every police car, every ambulance, every fire truck. The problem that you spoke of us taking an engine out to send a paramedic in the back of an ambulance when there's a critical call, whether there's CPR or bad trauma, is an issue for us. And the only way to solve that today is to take that engine out of service. That's not going to service going forward, but I don't have a solution for you yet, other than that we need to measure it first. We need to know how often that happens, how long our engine is out of service, and where the next responding fire truck could be.
Thank you, Chief. Jim?
Yes, sir. Mr. Humke.
Thank you, Chief. Chief Moore, if you could return, sorry. It says this light is on, but I can't hear anything. I guess that's not important, but as long as you can hear me.
If I can.
If you could fast forward to the ideal situation and give a time estimate of that. And is the ideal situation as follows? If we're in very south part of Washoe County, near the Welcome to Carson City sign on the freeway, you know, there's homes around there, it's real people, all of that. And let me construct literally a construct of the ideal situation. Would that be one dispatching whatever vehicle is needed, whether that's Carson Fire, REMSA, or whoever is needed at that medical transport event? Is that the ideal situation? Whether that's the SO dispatch or if that's REMSA separate dispatch?
Mr. Chairman, I believe that decision lies within a couple of things. One, how critical is the patient? And that drives how fast that the ambulance ought to get there. If it's a critical patient, then what is the time it's going to take for an ambulance to get there? So I believe we ought to construct in this agreement a standard then when we're right on the border, when we can have not only Carson City, but perhaps Story and also North Lake Tahoe assist, that there ought to be a standard of performance such that if REMSA can't respond within X number of minutes for a certain priority of patient, that triggers mutual aid. This is my opinion. And therefore, we get help to the patient a lot faster.
And I'm looking for the ideal, and you've stated the ideal. That sounds fine. That sounds like what citizens hope for and expect. How many more agreements does that take to achieve that, and how much time? Do we have that in the franchise agreement now?
To the best of my knowledge, it's not in the franchise agreement, and I would advocate that there should be some standard for that, yes.
Now, I think everybody here has had the private sector private meeting with Mr. Ferraro, Mr. Goebbels, maybe with their own city or county staff. We've all had the briefings, and there's this new franchise is sort of pregnant with the idea that there's going to be follow-on agreements. There's a task force, there's advisory committees, and perhaps we'll reach other agreements. Would that be a correct statement, as you understand it?
Yes, certainly your concern could be embedded in this new agreement, or it could be embedded in the process of EMS oversight to where decisions, better decisions are made once we know the data. So either is possible.
Okay. Just trying to make a record. You know, some of us will be gone before that happens, but can't make people come to the table, can't make them agree, but at least there's a plan for this. Would that be a correct statement?
Yes.
What is your ETA to get to that ideal situation? 5 years? 3 years? 6 months?
I would hope that we can get there within a year. Once the agreement is codified, then we move into a new process. I mean, what we're speaking of in getting ambulances to Wadsworth, getting them to Spanish Springs, or getting them to the outlying parts of the county really is process. And it's just making different decisions.
And does that perhaps deal, I just followed Commissioner Hartung's example, the very South County site, and you point out the other areas, Wadsworth, Gerlach, Story County, Lyon County, et cetera. Does that depend to some extent on the cooperator, the other end of the mutual aid agreement?
It does, but I believe that those mutual aid agreements already exist. So bringing those in as additional partners, I don't believe will be difficult.
Thank you very much. Thank you, Mr. Mayor.
Good morning. For the record, Jim Goebbels, President of REMSA. It's been stated that, yes, we do have mutual aid agreements. Those agreements have been in place for years, and it's with all of our surrounding ALS ambulance services. So that does include North Lake Tahoe Fire Protection District, Carson Fire, Story, North Lyon, which is Fernley, also Truckee, California. Because again, Truckee, California approached us several years ago because of the concrete barrier going down the west side of I-80. Even though that's Truckee Fire's service area, they're unable to get to those patients. So these have been in place for some period of time. Again, that call will go into the original service area. So if it's our original service area and we're not immediately in that area, then again, we can call that service for mutual aid. We do use that within our community, and I'll give you a prime example. Last Monday, many of us had a hard time getting to work, and it was because we did have moisture and it did create an ice rink out in our community. So we had multiple calls. We had a very serious car accident on Mount Rose. We did request mutual aid from North Lake Tahoe Fire Protection District. They did send us an ambulance, and they were able to help transport 2 patients off of that scene. So again, it is in place, it does work, and in turn, when they need our services, then if we have enough ambulances available, then we're able to render that aid. I'll give you a couple prime examples. The IHOP shooting. again, was a time where Carson needed our assistance. They did not want a ground ambulance, but we sent all 3 of our medical helicopters there. Again, we've had events even in Fernley where they've had hazardous material spills, where again they've requested our ambulances to come and service the area, and we've done that. The Reno Air Race event, again, we were going to look at all the resources we had in our entire region, which we did, and we requested mutual aid to respond to that. Fernley, North Lake Tahoe Fire Protection District, and Carson City all sent ambulances into our area, again, to assist. The one other benefit that we have in our community, and I don't want you to forget, is we also have a medical helicopter service. So again, when we have these very critical events, like Chief Moore has brought up, we also have a helicopter resource that we can send to assist with those patients. Fire or law enforcement can request that service, and we will send that service to those patients in need.
Yes, sir.
Thank you, Mr. Mayor. My question is for Sean. Thank you, Jim. Sean, this agreement, basically what we have today is just to codify the great work of the team the last 11 months and allowing this thing to move forward into documentation, correct?
Yes, you'll now write the binding interlocal agreement to change the way our relationship works with the health department. Mr. Liparelli's office will take the lead in preparing that interlocal agreement amendment, and that'll be back before you in May. We also need to write a franchise agreement that'll involve REMSA's attorney, and it'll involve members of the district attorney staff and working with the health board. And so those 2 agreements will now be written. We chose this path so that we didn't get caught up in some of the nuances, but could speak to the solutions. And that's why the principals agreement format was adopted by the managers.
And whatever the time frame is, whether it's 3, 4, 5 months, this joint committee or all of our individual councils and Board of Health will be seeing the final document that we have to approve as
Yes.
I believe the Board of Health actually gets to approve it, but we are subject to our ratification also, or?
You're going to see the documents. We wanted to do this with you all in the room. We think that's the most effective way so that we can work with Mr. Hartung's questions at the same time that you're doing. The signatories will be the Health Board and REMSA to a franchise agreement. That's a continuation of their longstanding franchise for exclusive service. And then the agreement will involve all of your bodies plus the fire boards for Washoe County, as they do sit as an independent overseer of those important fire and rescue services that they provide. So yeah, they do need to come back to you with all the I's and T's crossed by our attorneys, and we'll certainly make every effort to clarify the questions today that we're receiving and point out anything that the lawyers advise on that important issue of performance bond amount and how to deal with the terminal vesting, because those we do need an attorney's help on.
Just for my colleagues in this thing, I have memories of, that last joint meeting in which this item was in front of us, and if I recall correctly, it was pretty contentious. There was a lot of, it was pretty thick, the air was pretty thick. There was a lot of issues on the table, and I personally think, Sean, you and all the city managers, REMSA, the Board of Health, your staff, the fire department, this is a tremendous change to be able to come here and have everybody say, in the meetings I've had, the word trust has been out there, that we have a trust now that we're going to go forward with these issues. We're going to get this thing taken care of, and our community is going to be better for it. We have good service. We're going to have great service, and we're going to be able to do this. And in the spirit of where we've come the last year, I wholeheartedly, even though I have a couple of issues that I've spoken to you about and I've spoken to Jim about that probably need to be addressed somehow, I think in the spirit of things that there's, this needs to move forward, and needs to move forward at a rapid pace to get these agreements in place and get everybody moving forward to to get this done. It's been a long time coming in the community to have this type of cooperation, and I'd like to seize upon the opportunity of cooperation between all the agencies to get this thing moved forward. So thank you for each and every one of you for all your hard work. It has not gone unnoticed, let me tell you. Has not gone unnoticed, and I thank you.
Thank you, Mr. Mayor. I have a question, and it relates to the same questions that were asked by my fellow commissioners. I have a concern of the response time in the outlying areas. And as commissioners, we are the only ones that represent that area. And so we have to make sure that we work together with everyone, obviously, but we represent those constituents. And we are concerned, and I am concerned specifically, of the response time and in the outlying areas. Not only that, but what Mr. Goebbels had said about the other outlying areas that have response from Carson Fire, North Lake Tahoe, Story County, and what have you. Could Mr. Goebbels, I guess I will ask Mr. Goebbels this question. I know I emailed him at midnight last night, and I thank you for getting back to me. But could you really clarify the information? I understand that, for example, in Washoe Valley, if there is the need for an ambulance, REMSA, you have the ability, as we talked about earlier, you have the ability to request Carson Fire, for example, to respond. Am I right?
Correct. So what we've done with Carson Fire Ambulance Service, that's anything south of the Bellevue Bridge that is a serious patient and we are not immediately available, we will respond in ambulance. At the same time, we will also call for mutual aid, and if they can, they will respond in ambulance. If we get there first, then we will call them off. If they get there first, they will call us off, and then they will take care of the patient. It doesn't happen very often, but a few times a year it does happen. Again, if they get on the scene first and determine that they want the helicopter for that patient, then the helicopter will be dispatched for that patient. And it's the same relationship we have with all of the other mutual aid agreements that we have throughout our community. It just makes sense that, again, that we be able to request their services, and in turn, they can request our services in case they need our help in the community.
Well, thank you so much, and I'm so glad that we are able to have that service. But I look forward to having that data. I think it's very, very important because, again, our constituents out in the outlying areas need that service. And I'm just hoping that it is utilized as much as possible whenever necessary. But we do need that data, and I hope that in the future, we can get that data and you can show us exactly how that works.
And that's exactly what we're doing moving forward. This is a start today, not a finish.
Right.
So the start today is to move forward, form the EMS advisory board so that questions like this can get put on the table, and we study our system as a system, not just REMSA, not just this fire service or that fire service. We study the entire EMS system together and then jointly look at how do we take care of wherever we find the needs are. How do we jointly, not individually, but jointly take care of those needs?
And Mr. Goebbels, I just want to say that over the years, working with you has been great, but now that you're in the position that you are, I think it's been the best thing that's happened to our community, having you there working with all of us. I want to say thank you to all of our staff, all the folks, Sean Carey, our managers, the fire folks, REMSA, all the folks that have been involved. We just really appreciate you coming together. And I think that it's really a big step for our community to have you all working on this. Thank you.
Thank you.
Ms. Brackus.
Mr. Goebbels, when I first started studying this issue, I heard a couple different terms. One was public utility and the other was franchise, and maybe there was distinctions in some people's mind on what those were, but I'm seeing now the term franchise used. Is this the first time the concept of franchise is going to be incorporated into the Board of Health's agreement with REMSA?
No, when we started in 1986, it was designed to be a franchise model then. And what that model meant is the community got together through a blue ribbon task force and decided to basically give an exclusive right to one provider. Prior to that time, we had 3 separate ambulance providers in our community. So the franchise formed then an agreement with REMSA and the obligation then to provide ambulance service for all of Washoe County.
Okay, so it is a franchise, and I see one of the recommendations, I think it's number 6 on my page, let's see here. What I'm calling page 8 talks about work to assure the passage of legislation or administrative regs providing legal protection to all constituents. I guess that envisions sometime during the term of this franchise agreement, there'd be some maybe legislative rework as related to that. Is that your understanding of that provision?
What this particular element is discussing is for us to be able to share individual patient information, we do have to change some regulations, and some of it has to do with HIPAA, which is the Health Information Protection Laws, so that we can sit in a room and look at how fire performed, how REMSA performed, and then what we can do to improve next time on that particular type of medical condition. So it really has to do with the ability to share information and still be protected.
Okay, so if there are legislative changes, those would be worked through collaboratively, not individually by REMSA or?
Absolutely
okay,
collaborative.
Okay, because I just bring that up because, you know, as an observer of legislative process, I've seen industry go down to state houses in this state and others and try and change franchise or preempt essentially local governments from franchise authority. And I just want to make sure that, you know, this is going to be a long-term agreement, that REMSA will not be working outside of that framework independently. It would be a collaborative effort if we felt there was some need to rework franchise legislation in this area.
Absolutely.
Okay.
And that's what this whole thing
Okay.
forms, as a collaboration.
Thank
Ms.
you.
Edra.
Mr. Mayor, may I just continue on my line of thought about the franchise? On the term of the agreement, my first reading was that it goes out, say, what was that, till 16 years?
Correct.
But at that point, then the Board of Health, it's not an automatic kicker for an extension. The Board of Health has a decision based on performance standards whether or not to do the extension for, is it 6 years?
Correct.
And then another 6-year extension. And I don't know, my first reading, it looked like they were automatic kickers, and that's why I thought maybe the drafter would consider, you know, and if the Board of Health finds it's in the strongest interest of the community, then put in those kickers. But maybe that word may is so easily read that the board retains discretion on whether or not to extend that out, those subsequent 6-year cycles.
Absolutely they do, and that's why they'll look at it at year 10.
Okay.
Because if the decision is not to do an extension, then we still have a 6-year period of time to transition whatever we do for the community.
Okay, and then my final question is related to something Mr. Carey mentioned about if there's a RASI failure. That kind of made me think, wow. And I'm wondering, and I know there's some legacy language where it dictates the composition of your board. And, you know, with a franchise agreement concept, and maybe this is a question for legal, is I have not seen franchisees be dictated the composition of their board. And so I wonder if it causes any legal considerations, particularly if we do go into a wind down of their parent company. I mean, we're telling them very much how to manage their organization, who's on it, and I wonder if that is something that is inconsistent with a franchise framework.
We did have that discussion amongst the group, and at this time we decided to go ahead and leave the current board composition. 4 of those board seats are from the hospitals, and then 3 of them are appointed through the District Board of Health. So again, and along with the health officer sitting on our board as an ex officio. So after discussions, people were comfortable just to leave that the way it was.
Okay, and you are comfortable then that it's not preempting you as the franchisee from operating how you want to operate?
No.
Okay.
Okay, thank you. Ms. Zedra?
Thank you, Mr. Mayor. I think at this point, it would probably be helpful if we heard from Mr. Dick as well. We've had some conversations, certainly have heard the concerns that have been expressed, particularly by the county commissioners and the outlying services. And of course, the health department will be the ultimate manager of this contract once these entities agree to it. So I think it would be helpful for Kevin to speak to that. And in particular, Kevin, the fundamental services review that we're currently undergoing at the health department and how some of those best practices that will be identified will assist in this management.
Yes, good morning, Mr. Mayor. And Ms. Zadra, I don't disagree with anything that's been said here as far as our path forward in analyzing the data and establishing performance measures that are integrated across the system, looking at the various response agencies in REMSA so that we have a good response plan and map moving forward that incorporates all those capabilities. As far as our fundamental review, we do have a fundamental review that's going to be presented to our board February 27th. That review does address performance management and approaches for the health district. It certainly supports the direction that we're moving with this agreement and this hopeful action today. It doesn't get into specifics of the performance management of the response zones that we would be dealing with. So I don't think we're going to get a lot of additional information from the fundamental review in that regard, but we will have an EMS program manager and EMS staff. We will be getting all of the response data across the agencies, so we'll have the public safety answering point information where in the future, as we get a CAD-to-CAD system together, all of the information will on each agency's response and REMSA's response will flow into that. We'll have that unified data. We'll be able to associate the data from the different agencies' response together without having personal identification information tied to that, which will assist us in being able to work together to review, analyze that data across the agencies without getting into some of the HIPAA issues that we've faced in the past. So I think that we'll have this will provide us with what we need to move forward for managing the overall EMS system to optimize that performance and provide the most efficient and effective services for the money that we have to spend on it.
Great. Thank you.
Thanks.
And I would add to my total agreement that's been expressed already that, we've been working on this for 3.5 years. I think it was August of 2010 that we kind of initiated this activity. And this really speaks to the community-wide support. We're frequently criticized for being adversaries and not nearly often enough recognized for fundamentally how well we work together. And we've got many, many examples of that, particularly in the last couple of years. Mr. Carey, in particular to you, I know that you've kind of spearheaded this activity and it's taken a team effort from all of our managers. I certainly understand that. But there always needs to be someone who kind of takes on that leadership role, and you've done an incredible job. And if we have a little bit more that we need to bring forward on this, we were talking about a year for implementation of one of the pieces. I suggest we've got about 2 months with your retirement. So let's get busy and make that happen. Thank you very much.
Any other questions or anything? Ms. Weber?
Sorry, I have a few more questions, Mr. Mayor, if I could. Well, a few.
Oh, okay. How many is a few? One or two?
Well, I'll ask them quick, and maybe
That's
it can
right.
be given, the information can be given to me later on. I do have a question, and I guess this would be from Mr. Goebbels, but I hope that somewhere we can define on item number, it's in the Principles of Agreement. It's under number 1, and I think it's 1B. And it talks about the service area, which include in Washoe County, with the exception of Gerlach and North Lake Tahoe Fire Protection District. Is there going to be spelled out what those boundaries are? For example, in Gerlach, does it include Empire? Does it include Via, Hualapai Valley? I would like to know what the boundaries are.
And again, we need to go back to that individual service, and I believe that Mr. Slaughter has looked at that a little bit and probably has more information on that. This goes back to the very original franchise written in 1986, is those North Lake Tahoe Fire Protection District at that time had their own fire ambulance service. They wished to maintain that, and that's why they were not put into the franchise, along with Gerlach Volunteer Fire, opted out of this franchise agreement. But I know that Mr. Slaughter is looking at that and will work more directly with that.
How will we find out? Will Mr. Slaughter be the one that determines this, or how will it be spelled out within the agreement?
So.
Okay, who's got the canary?
I can tell you the way it works today, that again, they wish to serve their own community, and they do. And both Truckee Meadows Fire and REMSA help support that community with some equipment and some training and education. Again, if they have a patient, most of the time they'll either call Care Flight if it's a serious patient, or they'll start transporting the patient and then rendezvous with REMSA for REMSA to bring the patient the rest of the way into Reno Sparks to our hospitals so that they can return and again be available to serve their community.
I think my point is that it would be best if we all knew what those boundaries were. Does it stop at a certain road? Do we just pick and choose?
For the record, John Slaughter, Washoe County Manager. We are, through the end of this process, we began talking about that. We haven't come to a map, but we will have a map that maps the Gerlach, the portion of Gerlach as it's defined in the franchise agreement that's excluded. So through this process, we'll be able to show to all involved, how we define Gerlach as it's described in the franchise agreement. For North Lake Tahoe, the discussion may be a little bit longer. I know certainly we're dealing with a separate fire district in that case, and discussions need to be included in that discussion. We've just again restarted that discussion as well.
Okay, so will that be included in anything that we see before us in May?
Certainly the Gerlach portion can be included. The North Lake Tahoe fire, I think, is a little more complicated issue and may not be. I'm not sure if I can give you a timeline on that right now.
Okay. I have another question, and I don't know who it would go to, but on page 7, under the summary of recommendations, number 3, and we talk about Reno Ecom and the departments with volunteer fire services. What does that really mean?
What does that really mean? The study was written by Tridata at a time when dispatching was done by Reno Ecom, and there was still a combined fire department between Reno and the districts, and there were some difficulties under the Reno services agreement in its relationship with volunteers. So some of the outlying areas, how could volunteers be called with the professional firefighters that were now in an integrated system? Largely, this was written prior to what's transpired since then. And so we believe it will be addressed solely by the Board of County Commissioners as you direct your dispatch center and your fire chief, who's now responsible for that. And it's substantially changed. So Chief Moore will, I imagine, brings a board issue to you, which will let you know how his department will be using these volunteers and how the sheriff will be dispatching them in a comprehensive manner. But it was just the timing of when the Tridata study was done and where you are today. This is your action to take. Probably isn't needed in any type of either one of the agreements. It's simply your direction based upon what your fire chief believes is the best interest of the volunteers.
Thank you. Mr. Mayor, I have more questions, but I won't ask them.
Mr. Hartung.
Thank you, Mr. Mayor. For Mr. Goebbels, Mr. Goebbels, when you were answering a question for Commissioner Weber earlier, and you were talking about an issue in South Washoe Valley, the example was, and calling for mutual aid, and you said that if REMS or if an ambulance was not immediately available, define immediately available?
What I meant by that was immediately available in the area to respond to that.
Is it a
And
time
it was a
frame? Is there-
life-threatening.
And I
call.
understand.
Yeah.
So my question is it really comes back to when do we call for mutual aid? I'll give an example, and this is not an attempt to castigate by any stretch, but it's an important example. We had a constituent in the Wadsworth area, an elderly woman who broke her hip, and it took our station 37 over 30 minutes to get there. REMSA was right behind. The question is when we know that we're going to be 30 minutes out, or we even think we're going to be 30 minutes out, or 15 minutes out, or what's the point at which we say we need to call for mutual aid?
And again, it will go back to look at that individual situation and the resources needed for that patient and the acuity level of that patient.
So broken hip doesn't rise to the level. And I'm not trying to be wise. I'm not. That's not. I'm just. I'm asking. I recognize it's not as critical as cardiac arrest unless you're the person laying there with the broken hip.
Again, each one of those cases are looked at. If we needed mutual aid with that, it would have been called. I don't have that case right in front of me.
And again, I'm not
So
asking you.
again,
I'm
I
just
can't
citing
give
that
you-
case. My point with asking this is, as we move forward, can we establish a time frame that if we're not available within a reasonable period of time, 15 minutes, and there is an ambulance that is genuinely required, can we call for mutual aid?
And again, we can call for mutual aid. That's the agreements I have back with those individual services. And I think the thing that we've stressed today is we will start collecting this data, look at that data, and work collaboratively how we move this forward.
Thank you, Mr. Mayor. Thanks, Jim.
Ms. Weber, or excuse me, Ms. Sheedy, you have something?
Yes, thank you, Mr. Mayor. This question is for Mr. Goebbels. Last week, we had met, and I had asked you if there was something in this contract that you didn't get that you felt was imminent, and you had mentioned a regional medical director. Can you explain why this would be so important?
Again, what we're able to negotiate as a group, initially, the way Dr. Cohen envisioned this was to have one medical director over all of our services. The more we work through that, the decision was made at this point that we want to retain our own medical directors, but we're requesting those medical directors, again, to work collaboratively as we looked at system-wide protocols for how we address patient care and what medical protocols that we use in taking care of those medical or trauma conditions. So again, instead of having one regional medical director, we all agreed that we would maintain our own individual medical directors, but have them collaborate on what our medical protocols look like. So again, we still get the consistency out of that.
But you had felt that this was important to have one medical director, correct?
Yes, and like Sean Carey has stated, we all had to give and take in this process. And this is where we decided as a starting point for our EMS overall system that we would do it this way and then move forward. 3 years from now, we might decide something different.
Okay. And then also on number 38, it says the Reno Fire Department should not suspend responding to EMS calls even during high-volume fire responses. If reduced responses is necessary, EMS first response could be limited prior D or E-level calls. I'm not quite sure what this means exactly, and why is this only Reno?
The Tri-Data study, that was what he specifically identified as one of the concerns, was that during certain periods, Reno would make a decision during a lightning storm that they did not have the resources to respond to medical calls because they were on watch for a serious wildland fire. Those things can take off in a matter of minutes. And that was his perception from very, very high level. We believe that's a policy decision of the Reno City Council, working with your fire chief, to make the decision of how to use your fire resources during an emergency. And you have active battalion chiefs and you have a fire chief that are looking at all of the inputs. It could be a flood, an earthquake. In this particular case, it would be a very serious storm producing lots of lightning, and at that time, they would need to preserve their fire resources for that initial first attack, because if you don't get there fast, it'll take off. But it wasn't something that belonged in either one of these documents. It's a Reno policy decision, and it's not exactly true what that statement was. It was his perception. And I know Chief Hernandez and his operations and standards and the way he reports to you as a council member, we felt it was yours to work through. I don't think it is probably poorly written in the Tri-Data study to be a recommendation to begin with. And I believe Chief Hernandez does make critical decisions based upon what the inputs are. And he would want to make a decision not to be a first responder if he was placing the community in a greater threat for the limited resources he may have at that moment. And that's always Mike's job, and that's always getting the right people with the right equipment in the right time to make the most impact. And that's what he does every day. So just kind of the way it was there, we wanted to address it verbatim, and we felt it was a policy decision that Andrew could bring, have a discussion and maybe a work session with the council, and Chief Hernandez would certainly put you at complete ease on that issue, because it doesn't really rise to, shouldn't have been there, to be honest with you.
And then lastly, looking at what other cities do, I noticed that when they share this data, sometimes many of their websites will even show this data. Is that something that you think that we will end up having in the future?
I believe so. HIPAA is a constraint on that, and we must protect the identity and the medical conditions of any patient. But in terms of system performance, Andrew drove this issue, and he does want it to be transparent. You can already see what he's doing with fire department data. Chief Hernandez is responding to let you know where these resources are going, what their response times are. And that'll be much easier to do for Chief Hernandez in the future, as he'll be able to set subzones, and you'll be able to see what's going on instead, what's going on in Midtown. And Mike will be looking at these things based upon where his resources are. So that's one of the real principal changes that I think is going to be super for as big as the city of Reno is to set zones with your fire chief and allow you to see performance and where you're making an impact. So it's a really solid data system, and Andrew drove through transparency the entire time, so he was on that. I did want to touch on your first question, if I could. I believe what is important to take away from that is you're going to have the information as an elected official, and you haven't had that in the past. And if it's Washoe County worrying about a low-density area with low call volume, that one call is the most important call they're going to get. And Chief Moore recognizes that, and he's going to work on that issue when he has the data to find a way to get the best care. And you're going to do the same thing in that particular area. Why would you look at a utility? You're going to look at a utility because this performs economically better having one ambulance authority. And there isn't confusion as there was many years ago. And the agreement you have with REMSA that we're proposing will make it much more transparent for you as decision makers. Is this always operating at a high level. And that's where you are. You want to operate at a high level because it's patient care.
Ms. Weber?
Thank you. This would be for Sean. I just wanted to ask a question, Mr. Carey. What was the thought behind item number 23 in the recommendations, where we're looking at fines based on both, lateness and degree? And if we have fines for agencies, what about the actual patient? If we're doing fines for folks, have we forgot about the patient? In my mind, if they're late, somebody could die, how does that benefit the patient, having fines?
Well, we don't have a guarantee for public safety. We make a promise for delivery. REMSA has finite resources. Your fire chief has finite resources. And what we want to do is have oversight to ensure that this system is operating the best it can. There will always be an opportunity when a system of very complex inputs leads to a bad outcome. And we have had very few of those. The amount of fines that you collect is meaningless in terms of funding oversight. But it is important that we recognize that and allow for the health board to have input with REMSA and use those fines to do something good in the community. The folks at REMSA don't need to pay a whole bunch of fines. It's about their promise to you not to have fines at all. And we never felt that it was going to be a significant source of funding for oversight. That's why it could be, for any number of reasons, very unpredictable. But it's a very small amount of money. My recollection is it's less than $40,000. And what they do is with the health board and REMSA is they choose to make some unique community inputs to do something good. The infant car seat program has changed lives by making sure that we get car seats installed properly in cars, so that when there's an accident, the chair performs. And that is a benefit to society, it's a benefit to the emergency medical providers, and it's certainly the best use of those funds. So I think that in this particular system, we're recommending we carry through the use of those funds to do good in the community, to recognize the solutions are in performance, and that performance is never going to be clearer than it will be at the outcome of this agreement.
Thank you. And my other question, I think you could answer as well. On item number 30, we're talking about putting the whole committee together, the staff, EMS manager, EMS medical director. How will that be funded?
First of all, Dr. Cohen did talk about doing this regionally. And to Hillary's question, we have taken that very seriously in looking at what we need to start and where we need to go. And so we're not going to fill all these positions initially. And we're going to fill them to capture data, to put in place a manager of the system, and to have a health department doctor on contract to look at all these things. And so that's the important first step. The second part of that is we want to make sure that we're evolving this system. So this working group between your fire chiefs and REMSA will be in place to ensure that when we establish a new magical program for EKGs, they train to the same piece of equipment, and it's evolved within everybody's budgets, and we move on. So education will be provided by REMSA when we want to take part of it. But it's important to know that your fire chiefs needed their medical directors because they're working under a medical license within their specific liability, okay, and their specific ability to train. And it's an important resource for your fire chiefs to have is their medical director looking at the patient outcomes, looking at all that training that occurs to all of those first responders, in concert with the program of regional oversight. And I think it's actually going to allow you to have a better program because it'll allow the Truckee Meadows District, which has made the important decision to go to paramedics because of the challenges they face with response times. That was a decision Charlie moved forward with, and it was the right decision for him. We have intermediate EMTs and Sparks, and for our makeup of an urban, suburban city, it was the right decision. And so it's so incredibly important to the chief to hang on to those training standards and to have medical direction to meet the needs of a growing paramedic program in your case and an IMT program in the case of Sparks, and the same is true for Reno. And is there an opportunity to merge that in the future? Yes, there is. But liability and performance are at an agency level. And we don't turn away. And it happens in the field. When you do this number of frequencies, we have problems. And your fire chief needs to be the person that deals with that gives the proper training, the proper standards and protocols. But having these 4 doctors come together with the fire chiefs and the manager of this program is going to vastly improve any differences we have. Because anything you do in an emergency response, it needs to be something you train to so that you can perform it on any day, on any night, under any conditions. And that's what your fire chiefs ensure today, and this agreement preserves that training.
Mr. Carey, under item number 30, I'm sorry, it says that the chosen lead agency. So you're saying that the agency will be funded by?
Oh, funding, yes. There is a provision for Washoe County. This is a regional service provided by the health department. You'll be paying for part of the oversight cost, just as you do today. There's 2 positions funded there. There will be some positions added. We are drawing into this a percentage of input from REMSA. It couldn't be 100% because we have fire agencies, we have dispatch centers. All of those are components of the system. We chose to view this as a regional outcome, and so we chose not to have the funding be split 7,000 ways. It's a simple thing. It's not a lot of money, but having it clearly defined in the health department budget on a regional basis where you know what's coming in from a provider, you're then able to have a program which is sustainable. Economic challenges have been dramatic, and they're going to give you the position to look at this program and choose to make investments of resources at the right time to produce outcomes. And you really haven't had that before.
Thank you.
Ms. Reddy. Ms. Reddy.
Thank you, Mayor. First of all, just a general comment. I certainly over the last 5 years in my role as both a member of the Board of Health and a member of the Sparks City Council have made no secret of my frustration in being able to look at the performance levels of both systems and to be able to look at it as one system and a regional system. And so I got to tell you that I am just deliriously happy with the progress that has been made over the last year. I want to thank the County Commission for having the foresight to commission and fund the Tri-Data study. I think that it was an important first step to get us some analysis, to get us a third-party opinion that would allow us to come together and have these conversations. I want to thank all of the people who sat at the table and did the really hard work of coming to consensus. I want to remind everybody that we're not starting with a blank slate. We're talking about what we have today and what are we moving forward to, and is it better? And it's clearly better. I mean, I just can't emphasize how much better it is. So I really want to just say thank you, particularly to Mr. Goebbels from REMSA, who came to the table with a spirit of cooperation, and to Sean, you, for your leadership on this. That said, I have one minor change. One minor change that I would like to ask, and it does speak to the question of funding. So my experience in my 5 years, which is not as long as many people here at this table, is that we make agreements, and if we don't make them absolutely simple and crystal clear, what happens is 4 to 5 years from now, people go back and they look at these documents and they try to figure out what we were thinking, and there isn't always clarity there. So the suggestion that I would like to make is that rather than asking that REMSA provide 25% of the cost of any additional expenses moving forward, which requires that people in the future go back and look at what was the original base and what was the original starting point. I would like to propose something that is the same dollar amount as a starting point, which is 12.5% of the overall cost of the administration. And that way, moving forward, 10 years from now, people won't have to look back and try to remember what the starting point was. They'll only just know that it's always 12.5% of the overall administrative costs. And if Mr. Goebbels is in agreement with that, and if Mr. Dick is in agreement with that, I'd like to recommend that change, just to keep it simple.
Yes, I would be in agreement with that.
Thank you.
Ms. Burke-Bigler. Mr. Dick, you have something?
Kevin Dick, for the record, I'm in agreement with that also.
Okay, good.
Great, thank you.
Make that amendment when we make a motion in a little bit.
I would be happy to do that.
Ms. Burke-Bigler.
Thank you, Mr. Chairman. I just have a really quick, very simple question based on, and for you, Mr. Carey, based on the, going back to Dr. Cohen's initial statement, if we don't do anything else, let's fix dispatch. How long time frame before we're all on the same system, we all speak to each other, we all know what it looks like?
Well, you know, we're very fortunate to have Mike Haley's leadership in this area. He brought in a real experienced voice to this, and he's been so well positioned on state committees, understands radio, and has a real team of professionals that have just done a great job guiding us in this. One of his significant breakthroughs is his work has led to a gateway, a new portal, so that we will be, in just a few weeks, not months, not years, able to have communications between dispatch centers day one, when that gateway is open. And that's going to be a brand new tool for dispatchers and fire chiefs and battalion chiefs to open up real-time communications. We then have the evolution of Tiburon that Sheriff Haley spoke to. And that's happening. And it happens at the pace and scale of software implementation. And currently, we expect to have the system live in January of 2015, and it will begin to produce results sometime after that. And the folks at REMSA have agreed that they are going to design their dispatch system to give us the data into Tiburon, and it'll be properly mirrored. And we had a lot of talk about it being virtual linked. It's going to be linked under the leadership of the primary dispatch centers and REMSA in its quickest time available. But those are how those systems will work. But the most important thing is the future. It's been very difficult to guide investments in technology in this area because there are always long lead times and high costs. You're going to see a 5-year capital improvement program for what we need to do in emergency medical services. And that's going to allow you to prioritize that and make those investments together. And I think it will lead to us doing the right things at the right time. My preference is to place a high priority of getting this gateway, then getting the CAD systems working, and then I believe from there, the group that could come back together and bring you a 5-year capital plan, and you would be able to see what produces the most improvement. My gut feeling is it's going to be this automatic vehicle locator system, but I'll leave that to the professionals at the time to bring you a recommendation. So you'll see financial reports, you'll see operating reports, and you'll see capital. Those reports will be to you in this January, February timeframe so that you can budget to those. All of you can budget to those, and it'll all come together. And that's what the future provides you.
Any other question? Yes, sir.
Maybe I can have Chief Hernandez, if he's around. One of the questions that I've had as a newbie to the city and overall is understanding the who provides first response. I understand, maybe you can correct me if I'm wrong, but REMSA transport, but they also provide services as a first responder. Are we able to do all of the same performances, provide the same services once you're there at the scene?
For the record, Mike Hernandez, Reno Fire Chief. What we operate currently within our city and in Washoe County, we operate a two-tiered system. And what that system consists of is fire operates first response, and REMSA operates a second tier, which is the advanced life support transport component of emergency care throughout the community. And basically what that means is when the call comes through the 911 system, fire is dispatched, or the closest fire unit is dispatched. And in our particular case, we are trained to the intermediate level. I believe Truckee Meadows is moving towards the paramedic level or the ALS level. REMSA currently operates at the paramedic or ALS level. So you have a two-part, sort of a 1-2 punch. You have fire responding, and you have the REMSA system responding, their closest unit. We arrive, we assess the patient, we provide what care we are capable of providing, and then we pass that patient off to REMSA. Now, there are times when we arrive prior to a REMSA, hence the need for fire responding, and there are times when REMSA arrives well in advance of fire. So we complement each other. So that is the essence of the two-tier system, and we operate in as best as possible to augment the best service delivery to our customers.
Help me understand. So Truckee Meadows is moving towards a paramedic. We also have paramedics as part of our fire department.
Currently, we do have a little over a dozen paramedics that are certified. However, our agreement is that our medics operate at the intermediate level. We will be going into negotiations soon, and I'm willing to bet that that's probably going to be a negotiation point. However, we are restricted to operate at the intermediate level, and that is how we currently function. And so we do have, again, I'm going to look at Charlie, but Chief, you have all of your units paramedic, or you're moving towards that? I'm sorry? Okay, yeah, Truckee Meadows will be moving towards an ALS system where their paramedics would basically deliver the same level of service that the REMSA paramedics do. And we currently operate at the intermediate level, so we're just below that. There are certain medical protocols that we simply cannot do because we are restricted to that intermediate level.
I'm stalling here for a second because I'm trying to think about how, as I think Commissioner Hartung, it's kind of the same idea, is if there's somebody in a certain risk or has a certain health issue, they call 911 and we respond first, happen to be there. Are you saying that we can't provide a certain service because of certain contracts we have with REMSA? Is that my understanding? Or no?
No. I'm sorry, sir.
Okay.
If I misled you. We provide intermediate level service pursuant to the stipulations of our labor contract, not with the contract that we have with REMSA. REMSA provides paramedic level support service. We provide an intermediate level. Now, it is case specific. We could have an individual that has a dislocated knee, for example. We would go and stabilize the patient. We would do everything up to our intermediate level capabilities, and then we would pass that patient on to REMSA and their system. Not all calls are life-threatening. They need a paramedic. There are certain calls where the severity isn't as severe, and we would show up and we would evaluate that patient and let REMSA know what exactly is the status of that patient. And likewise, REMSA will show up and they would advise our incoming first responders that they can cancel or they can reduce their code, but they're still going to need assistance, et cetera. So the level of care is the best to each respective jurisdiction. Truckee Meadows provides a level of care, North Lake Tahoe, the city of Sparks, and of course the city of Reno. The terms that we are currently speaking of within the franchise agreement don't speak to that. This is an internal City of Reno labor union contract language that we would need to address.
Okay. I don't want to keep beating all this, but I remember quite clearly Dr. Cohen stating that if nothing else, and I think Chief Moore had stated this earlier, about having a central dispatch. I know we're talking about CAD to CAD. Can you guys elaborate a little bit more on what's still going to be that gap missing from CAD to CAD to that central dispatch?
Well, currently as a system exists, and I'm going to look over my shoulder to the sheriff, but currently as a system exists, that call comes into the 911 system, and what we do is we take the name, address, phone number, and is it a medical call, and we immediately respond. And then we transfer that call over to the REMSA system so that they can triage the call. I believe it was Dr. Cohen's intent to have a consolidated one-stop shop. Whether the REMSA dispatching system moves into our building, whether we have CAD-to-CAD link, whether we, as the primary access point for emergency services, assume that function. I believe it was his intent that of all the things that we discuss, that would be the single most important thing that we address. And I believe, as Sean Carey, Manager Carey stated, that we are moving in that direction, whether it's a virtual CAD-to-CAD link, the ability for our two systems to talk to each other, whatever form that we adopt, that was the single most important thing that we address, and that was the dispatching component. And I believe we're moving towards that.
What's our fire response time for when we get a call? And then can you tell me what REMSA's average time for response? I know there's data information, and we're still missing some of that, and hopefully we'll get that data as it comes by, but I'm sure there's numbers now. Can you kind of tell me what those average?
System-wide, we respond in just under 6 minutes and 40 seconds to 100% of our EMS calls. And that's, again, we're responding to 100% of all of our calls. We have tracked some data points with respect to when we arrive prior to REMSA and when we don't. We are somewhere in the neighborhood of about 70%, 75%. We arrive prior to a REMSA. And then the wait time can vary anywhere from a minute and 30 seconds to 7 to 8 minutes. Now, I have to throw a little asterisk there because, again, some of the calls that we respond to are twisted ankles. They're minor calls. And some of the calls that we respond to are extremely, extremely serious. So we took a snapshot of 100% of our calls from November to November of last year. And we responded to 100% of those calls. And that was the data that we had. But whether we respond to a priority 1, a priority 3, our average response time is about 6 minutes and 40 seconds within the city of Reno proper.
And then the contract that we're going to be talking about here, what's the response time that REMSA has said that they'd provide?
I believe it's 8 minutes and 50 seconds.
So 8 minutes, 50 seconds for medical, and we respond
Correct.
to fire and anything else within 6 minutes?
I'm sorry, I couldn't hear you.
And we respond to fire and medical within the city of Reno within 6 minutes?
Our response time criteria for fire calls is just over 7 minutes, 7 to 8 minutes to have the first arriving scene. We have an effective firefighting response force of 12 minutes, and that's to have 3 engines, a truck, and a chief.
Okay. Mr. Carey, sounds like
Sheriff Haley did an awful lot of work on this, and I'd like him to address some of your points, if you would, Mr. Delgado.
Mr. Chair, Councilman Delgado, I'll be very, very brief. The Tri-Data report supposed and recommended that we have a single dispatch mechanism here. Any single dispatch mechanism needs a secondary dispatch. In this case, Washoe County and Reno are together right now, and if there's a failure, single point of failure there, Sparks becomes the primary PSAP for us, or vice versa. The other important factor here is that on your radar in the future, we need to either pull all dispatching under the sheriff, we need to either pull all dispatching under the city of Reno, or we need to hire somebody to do it. It's irrelevant who is in charge of it. It's relevant that it's all in one place with a secondary. So then we can start getting rid of all of these links, because these links, while very effective, are links, and they have ability to drop. So I hope that informs. I think we have to have a centralized major dispatch mechanism here, and that's what Tri-Data said we should do.
I agree with you. That's what I was kind of asking where, I understand the catty cat and everything, but there's still gaps in between communications and where that may fail. So just talking in general, the region is what kind of, how did that conversation end up to where it is? And I don't want to draw it too long. I know we have a limit of 11 o'clock to be here, according to what the city provided us earlier with the rules, but joint meetings, so we're concurrent, right? We're concurrent, not joint. I guess that was just my overall understanding is having a central dispatch, and we're still with the catty cat, and I see that as something that it's an improvement, but it's hard for me to kind of grasp that we can't simply just do that.
Well, at the end of the day, Commissioner or Councilwoman, Mr. Carey had 38 items to resolve, and we have to give him enormous credit, and others, that we got to where we could get. And this is the best possible solution at this time, but we cannot stop our work going forward. What we get out of this is vital information necessary for fire to be able to make informed decisions going down the line. You know, we'll all want to continue to march forward and move together in one happy family.
Of course, not to suggest that you guys didn't put in a lot of hard work or anything else.
Thanks.
But yeah, thank you.
Ms. Jordan.
A quick question, and then I don't know what's remaining here, but I'm certainly prepared to make a motion on this. Chief Hernandez, you made a comment about rolling on twisted ankles. Once this data is, assuming we move forward today, and once this data is gathered and we can better define times responses and what types of calls and that sort of thing, is that the opportunity where we can potentially narrow or more clearly define the types of calls that, let's say, fire rolls on? Where does that happen? Does it happen at this level, or does it happen at the union negotiation level?
For the record, Mike Hernandez, Reno Fire Chief. That's a very good question, Council Member. As a matter of fact, we have already initiated the process in light of the fact that we will continue the same model, that dispatch will receive the call, and that EMS call will be forwarded to the REMSA system for triage, EMD. What we have already initiated discussions with our medical director to determine what calls are of the utmost priority, what calls must we roll on, what calls are important to us to roll on, however we can roll without red lights and sirens, and what calls simply do not warrant a fire response. Once we determine that criteria, we will reach out to the REMSA system and work with their medical director and say, this is what we are looking at, take input from them, and we will adjust our dispatching protocols accordingly. I believe that when we did have our one-on-one discussions with the council members, I brought this up, and this is currently our path forward. We have already initiated those discussions with our medical director, and we are looking at somewhere between a March, April timeframe for pulling the trigger on that type of system. That is outside the labor contract parameters. To specifically answer your question, that is a question that is an issue, a service delivery issue that rests solely with the city council and fire department leadership.
Thank you, and I think that's great from an efficiency standpoint, and certainly from a taxpayer observation. That seems to be a frustration that they have expressed.
Can I follow up on that?
Sure.
Just real quick, is that going to come back to the council though for approval?
It is my intent to provide an update to the council. I can certainly make that an action item so that it would be at the vote of the council. However, it's whatever the council desires. I can certainly bring it back as a presentation or an action item.
Perfect. Thank you.
With that, Mr. Mayor, I am prepared to make a motion.
Wait a minute,
Oh,
we
I'm
got
sorry.
a couple more questions down here.
Thank you, Mr. Mayor. I believe this would be for Mr. Goebbels. We spoke over the weekend through through Mr. Ferraro, and one thing that I asked for in terms of reporting, item 6, is that 6A 3 on comments and complaints, that the way that you collect that data, the survey that goes out with the invoice, I believe, and then that data comes back to you, if you could have at the bottom of that call REMSA for comments or complaint, or the District Board of Health for comments and complaints. So it actually, there's two channels. And also that the public is aware that REMSA has, the oversight to REMSA is the District Board of Health, and as well as on your website, et cetera, just so that that information is further out there and there's more eyes looking at the, and other channels for public to go to should they have a comment or a complaint.
Yes, and again, like you stated, we do send out a comment card for every one of our patients that we transport, but I think, like you suggested, there's other mechanisms because we also have that comment card on our website. So again, we can certainly look at adding to that. I would check, of course, with the health officer first before I did that to him and make sure that we list a correct number for him to give patients a choice of either doing our system or calling the health department. Yes.
Okay, thank you, Mr. Goebbels. And then finally, I do have a question for Mr. Carey, and that is item 9, dispute resolution, 9A. All that's addressed here for dispute resolution is the rate increases. Are we looking in the future to have an area in the franchise agreement that also looks at any dispute resolutions, getting a mediator, et cetera? Was that something that you've put off because you couldn't get there, or is it something we just maybe forgot to put in there?
No, I believe that the way we have included concurrent review, and in the interlocal agreement in Section D, we place the city councils, the commission, we're bringing forward data and information. I believe it's a two-way street now, and to rely upon mediation for things that involve service and investments, I didn't think that was a good way to go, to put it in the hands of someone else. You'll be empowered to take the concerns for your constituents, who are the entire county in the case of the health department, and that will be able to be seen by Reno and Sparks, sitting as elected officials as well. So mediation is going to be done in rooms like this. In the case of billing disputes, we did make a change there, and that was to focus on a specific business process that we felt should change. But underlying this agreement is you're now empowered. And so when something is coming up to you from the health officer, when you're sitting on the health board as you do, you're going to be able to assess the impacts, choose the right actions to take. And this isn't a blank check. It is a partnership with REMSA in this franchise agreement, and it is a partnership between all of you in creating a health department. And concurrent review is I think, the most powerful thing you're gaining as elected officials, because you're no longer locked out. You're at the table.
Thank you, Mr. Mayor.
Okay, having no other questions at this time, do you want these, legal counsel, you want these motions by individual entities?
Yes.
Okay. City of Sparks.
I'll take it.
Yes, ma'am.
From the City of Sparks, Ms. Ratty.
I move to approve the full development of an updated franchise agreement between the Washoe County District Board of Health and the Regional Emergency Medical Services Authority as proposed by the Emergency Medical Services Working Group, and direct the Washoe County District Attorney offices to prepare final legal agreements to match the principles of agreement to the franchise, with one small amendment, which is to change the 25% of REMSA on just the additional cost to 12.5% of all of the oversight costs.
Do you have a second? Mr. Schmidt?
Actually, there's a Part B.
Oh, go ahead. Sorry.
And I move to approve the full development of an interlocal agreement concerning the duties and responsibilities of the entities participating in the Regional Emergency Medical Services Oversight Program.
Mr. Schmidt?
Second with the changes.
Second. Okay, I have a motion by Ms. Ratty, seconded by Councilman Schmidt. Any further discussion? City Sparks. All in favor say aye.
Aye.
Opposed? Passed unanimously.
Mr. Humke.
Does anyone wish to make a companion motion or a different motion?
Mr. Chairman?
Go ahead.
Thank you. I'd like to make the same motion that was made by Sparks.
There's a motion by Commissioner Weber, second by Commissioner Hartung. I have an inquiry as to the 25% fee, which is now split between REMSA and District Board of Health. As a practical matter, anytime you do that, that means the county bears the costs. Is that the intent of the county to enter into that agreement? I don't mean to be disagreeable here, I'm just trying to state some facts.
So may I ask a clarifying question? So for clarity, the intent of my changing it from 25 to 12.5 doesn't change the dollar amount in any way. It just changes what that 12.5% is applied to, and the dollar amount remains the same, just so that we're clear.
Mr. Chairman, I know you understand that comment, but I still would like to keep with the same motion.
All right. Any other discussion from the county? Hearing none, all those in favor, please say aye.
Aye.
All those opposed, please say no. It passes unanimously.
County Health Board.
I'd like to make the motion that City of Sparks also made.
Second.
Got a motion, a second, all in favor?
Aye.
Opposed? Motion carries.
City of Reno, Ms.
Mayor?
Edra.
The same motion, parts A and B that were proposed by Sparks.
Second.
Have a motion, second.
Excuse me. Can I just ask, just moving forward with the standard of performance that Chief Moore mentioned, will this be moving forward?
That's
Do
part
you know?
of the motion.
All right, I just want to make sure, just for the record, very important that that's in there. All right. Go ahead.
Have a motion, have a second. All in favor, say aye.
Aye.
Those that oppose, no. Motion carries unanimously. Well, do we have any public comment cards? Having no public comment, I'll close on my favorite motion.
Oh, wait.
Have a motion.
Wait. We've got comments from the Commission Council, and I do have one.
We've already made for a motion to adjourn. You can't talk. Go ahead.
I do object, sir. I do object.
Go ahead, Ms. Reddy.
I'm afraid this may be the last joint or concurrent meeting, whatever it is that we've just done here today, that we will have the favor of our own city manager, Sean Carey. And I could not let this meeting close without extending my personal thank you for your leadership. It's been a pleasure to serve with you. I know we've said it over and over again today in this meeting that I fully believe that we're here today because of your leadership. And we in the city of Sparks know that it's not just limited to this particular issue, but that it's been a full career of some astounding leadership. So I just wanted to say thank you so much and have the entire community say thank you.
On behalf of the city. I don't know how they let them get away, but that's okay. All right, now my favorite motion. Have a motion, second. All in favor, say aye.
Aye.
Those that oppose, no. Motion carries unanimously. We are adjourned.